Hey guys, welcome back to my YouTube channel. Today I'm going to be doing my first car vlog. And so this will be the first of many, I think. I'll be doing more in the future. But in today's car vlog, I wanted to talk about my extracurricular that I've been doing for med school. And it's scribing, ER scribing. Um, and yeah, I'll just give a little talk about it. So basically, I started scribing under this company called Scribology. And so I did my training, it was online training. I had to study a couple of terms and pages, and I had to take their online exams, which are proctored by a person from Scribology. And so you would have to get a certain score to like pass the exam, and I think it was like 80 something. And if you pass the exam, then you would move on to the next exam. I think there were like 2 to 3 exams. Once you pass the like online stuff and you do all of your onboarding, and all of the onboarding involves like all your vaccinations that you need to work in the ER, urine drug screen, obviously. Then you can start working in person. In person, you normally with all these scribe jobs, you'll train under someone for a couple of shifts. My experience was that I trained under a scribe trainer, which was, I mean, the shifts were around maybe 7 shifts. They give you around 7 shifts to get trained. If you need more than 7 shifts, then you can do more than 7. But usually I think the max will be, I think around 10 training shifts. Yeah, it's around 10. But yeah, I mean, for me, it took 7 shifts. I trained at Baylor, both locations. I had 2 locations. I won't say the locations, but yeah, they were ERs. And so basically I switched to scribing by myself at that point after the 7 shifts. And overall, I really liked the job. I mean, the first month was hard because, the doctors, they talk so fast. I mean, some of them talk really fast. It's like you're writing, but you can't get all of which like they're saying. So you develop these like shorthand texts for words that you commonly use, and it helps a lot. But the first month I was in the process of developing these, and so occasionally I would have to ask the doctor to repeat himself, and that's perfectly fine, by the way. Don't be scared to do that. But yeah, after the first month, I got used to like the EMR, which is the system that they use. I got used to charting, and at that point, after a month, I was able to chart like a patient's chart under maybe under 5 minutes. It's not that bad, but it's a very good job. It's independent. You don't have to do a lot of talking. I mean, you're working with the doctor. That's the only person you're gonna have to talk to. But I mean, that's good because if you get a close relationship with them, you can ask them for letters of rec in the future. But scribing as an experience, it's really good. You get to see so many things. I saw plenty of things. You just have to ask to come and watch for some of them, or the doctor will ask you if you want to watch. Some of the things that I saw were like, obviously there's like stitches on different injuries. There's CPR on people that come in with cardiac arrest. There's gunshots. There's intubations. There's pneumothorax procedures, where they go to the side of your chest with like a tube because you have like space in between your chest and lung, I think. But yeah, I saw that. That was pretty cool. And then you'll also see like the regular stuff, or I guess like the sick stuff. And that involves, like the complaints of chest pain, shortness of breath. And then there's also the less complicated stuff, which is, viral symptoms, other things, rashes. But you get to see like the workup involved behind all of these patients and how the doctor talks to them, what type of questions they're asking. And overall, after you see a lot of these interactions, you start to pick up on the types of questions they're going to ask. So you can start to anticipate what they're going to ask, what they're going to order, what their workup's going to be. For example, like if a patient comes in with chest pain, like doctor's probably going to order a troponin to see if they're having a heart attack. But yeah, after scribing for 4 months at Baylor, I did switch to a different hospital because of it was higher pay, but it was relatively the same thing. However, this one, it was a lot closer relationship with the doctors. It's like a little cubicle room, and I sit next to the doctor, whereas at Baylor I was sitting farther away from the doctor, not in the same like cubicle area, if that makes sense. But yeah, this new place, it's good. I've been working at this place for like a year. And so it's a closer relationship with the doctors. You can ask them more questions. They ask you more questions. And overall, scribing's good. You get to develop this clinical shadowing that med schools like to see. And yeah, I mean, all scribing jobs are relatively the same. You just need to get to get used to like the EMR that they use. But overall, it's a good experience. I would recommend it. And yeah. All right, guys. So I actually forgot describing what scribing actually is in the video, which is actually pretty funny. But so scribing, basically, you go with the doctor to see different patients that they pick up. So I scribe in the ER, so we go see the ER patients. Now, scribing can exist in other clinics in different forms, but the most common one is ER scribing. And so the interaction that the doctor has with the patient, you'll be documenting that. So I usually bring like a clipboard with me with like a piece of paper and a pen, and I write down the history that the patient gives about why they're here today. And yeah, that's what I do. I just write that down, and then afterwards or during the interaction, the doctor will give like physical findings, which means like, so if they press on the patient's abdomen and the patient's in pain, they'll say like, maybe if they press like right here, they'll say like right upper quadrant tenderness, abdominal tenderness, and you would have to document that under the physical and the findings of the chart. There's review of systems, that's just what symptoms the patient's complaining of. So basically so what I do in the chart, I do the history page, which is the interaction and the history page consists of the ROS, past medical history, social history, and like the story of what they told us when we went into the room. And so the next page would be like the physical page, which is what I just now talked about, the actual physical exam that the doctor does. And then at my old place at Baylor, I didn't put in lab results or any like type of results except for the occasional like EKGs. And the EKGs, the doctors will interpret it, and then you just put in their interpretation. At my new place that I work at, that I've been working at for the past year, so I wouldn't really call it new, but I also put in lab results, and that includes like the CBC results, CNP results, like the abnormal findings, and then occasionally I'll put in like the imaging results. That includes X-rays, CTs, and yeah, so I just like copy like the impression, put interpreted by radiologists. But I also put in the EKGs here at this new place. It's the same process. The doctor will interpret it, and then you'll put in their interpretation. Aside from that, you don't really do much as a scribe aside from those things. Now, obviously, it's different with certain doctors. I know there's this one doctor I work with where I do some of the discharges sometimes. So I'll put like the clinical impression, like the overall diagnosis that the doctor will give for the patient, and then their follow-up and things like that. You don't put in any like prescriptions or orders. I don't think we're allowed to do that. But yeah, also at some places you'll also do like differential diagnoses, which means like the list of things that the doctor thinks is wrong with the patient after seeing them. So it's like their guesses almost as to what is wrong with the patient. And yeah, that's what scribing is. You do have quite a bit of downtime depending on where you work, and in that downtime you can just use that to study and do homework and whatnot. Most places don't really mind you doing that. They expect you to do that because most scribes are pre-meds, pre-meds in college or students taking gap years. So yeah, I really like the job. It gives me a lot of time to like study as well. It's a good experience. But yeah, that concludes today's car vlog, which is my first car vlog actually. But I will be making more car vlogs about different extracurriculars and other things. If anyone actually made it to this point of the video, if you have any questions, let me know in the comments. I'll answer them. But I'll be making more videos about maybe like research. I recently got into research at my college, so I'll be talking about how to get into research and what that consists of. I'll be talking about maybe volunteer medical assisting. I'm a volunteer medical assistant at a free clinic, I can talk about that. Overall, I'll just talk about multiple like things along my pre-med journey. And yeah, thanks for watching. If you made it to this point of the video, I appreciate you. Make sure to subscribe. I only have 10 subscribers. It'll be nice if I have more. But yeah, I'll see you guys next video. Bye. Thanks.